tibia controlled hip IR stretch. In the prone line, tibia controlled hip IR stretch, one of the best things to do is really I like to always start this stretch by checking the client's internal rotation. So in this case, she has very even internal rotation, and we would know that from the evaluation as well as the repeated microcycle pre-stretch therapy evaluation. But it's always good just to check in session. It only takes you, 20 seconds to do that assessment, and your client knows that you're looking thoroughly, you're doing a little assessment prior to actually doing something on them, which just gives them a better feeling of assurance that you're really doing things for a reason, right? Which is really what you should be doing is the most important. The prone line tibia controlled hip IR stretch, you're going to make sure that the knee or the femur, more importantly, stays in that neutral position. It's not coming into hip abduction. It's staying in that neutral position. And the way you should apply this stretch, especially if your client has meniscal tears, especially medial meniscal tears, it's really important that you don't just pull on the leg here. Definitely not the best way to do that. You want to place the hand down here towards the knee joint and actually use your entire forearm to rotate the client's thigh out. And by the way, this client has pretty good hip internal rotation, so this wouldn't be really a stretch that we would be applying on her. Typically, when you're applying this prone line tibia controlled hip IR stretch, this is for clients that are going to be restricted in like the 20 degree or 25 degree or less range, and definitely under 30 degrees, of course. So then, once you're in this stretch, yes, you can just kind of brace and hold the pelvis from the upper quadrant, your hand placed centered there, and just ask the client as you go into the stretch, 1 to 10, how much stretch do you have?
5.
Okay, so she's a 5. That's about as far as you want to go with hip-specific stretches, a 5 of intensity. And so you could just apply the stretch that way. But you can also apply the ART method to the external rotators of the hip, which is really the most effective way to do this. You'd start on the very top of the pelvis, and you'd also make sure you start in the actual tissue. Now, if your client has lower back pain and hip pain also, or either of the two, you could start with a massage in the lower back, doing both sides, and then working through the tissues there. And then you could do one side with the palm, kind of circulating, creating more blood flow to the area. Then once you get here, applying pressure with your thumb, or if you don't have that strong a thumb and your client is really strong, you could apply the elbow. In this scenario, me applying elbow pressure to a female client that only weighs 125 pounds would not make sense whatsoever. But if you're a female applying this to a 230-pound male client, that might make a lot of sense to use elbow instead of thumb. So apply the pressure, whether it's elbow or thumb, starting medially in the tissues and superiorly. So find where you can find actual tissue that you're not on bone. Once you're there, in most medial and most superior, once you're there, dig in deep. So on a 1 to 10 scale, how much pressure do you feel here?
5.
5? Okay. So you can go up to a pressure of a 9 on a touch. Touch intensity being different than stretch intensity. So touch intensity, we can go to a 9. We don't really want to take clients to 10. There's really no reason. Also, you can get a lot of effectiveness from 5, 6, 7, 8, and of course up to 9. But don't go past 9 with the touch. Digging with the thumb, drawing into hip internal rotation, using the forearm. So I'm going to be about a 7, 8 here with the touch, and getting to a 5 of stretch. Applying, digging, little circular motions with the thumb or elbow, and then going out to the next lateral position. And what you'll do is you'll start medial superior, you'll work through all the tissues, kind of like you would mow a lawn, right? You mow the lawn in one path, and then you make sure you get all the next grass. That's exactly the way you apply this method. Start superior medial, and go out lateral through all the tissues, out to the side of the pelvis there. Go down one row, and then start working from medial to lateral, all the way through all the external rotators, through the piriformis into the gemellus brothers there, and all the way down into the lower glute. And as you get to know your client, you'll know where they have the most adhesive tissue and which area you should focus on that you're going to get the most effectiveness from the actual ART method.